A middle-aged man, Javier, working on a construction site, slips and falls from a scaffold. He hits his head hard against the ground and lies there motionless until his colleagues rush to help. He's in bad shape. They can see he is covered in abrasions to his face, responding to them, even though they are shouting and shaking him. They decide not to move him just in case. The paramedics are on the scene in no time. They note that his pupils are sluggishly reactive to light and that he has a CSF leak from his nose and ear. To confirm this, they put a drop on a glucometer and it registers a value. This is one of the easiest ways to confirm if a fluid leak from the nose and ears is CSF or not. Other methods you could use in the emergency room are break time once. Physical examination. Observe for clear fluid leaking from the nose or ears. Check for the presence of the halo or double ring sign on a gauze pad or tissue. This test involves dripping the fluid onto a pad. CSF will create an outer ring around a central blood stain, protein content. Beta-2 transferrin test. This is a highly specific test for CSF. Beta-2 transferrin is a protein found almost exclusively in CSF, making its presence a strong indicator of CSF leakage. It requires collect fluid and sending it to the laboratory for analysis. Glucose testing. CSF typically has a higher glucose content compared to other bodily fluids, like nasal secretions. A glucose test strip can be used, though it is less beta-2 transferrin test. CT scan. A high-resolution CT scan, particularly a CT cysternography, can be used to visualize skull-base fractures and potential sites of CSF leakage. It may not directly CSF leakage, but can identify the anatomical defects through which CSF might leak. MRI. MRI, especially with contrast, can help in identifying the site of the leak, though it's less commonly used for acute diagnosis in the ER. Intrathecal fluorescein administration. In complex cases, fluorescein dye can be injected into the subarachnoid space. Its appearance at the site of leakage, observed under a specific wavelength of light, can confirm CSF otorrhea. This is typically done under controlled conditions and often in an ENT or neurosurgical setting rather than in the ER. This confirmation of CSF leakage by the paramedics should alert you to the fact that he has skull fracture. There are 3 other cardinal signs we look for in these fractures: raccoon eyes, Battle's sign, and blood behind the tympanic membrane. Raccoon eyes, also known as periorbital ecchymosis here. These are early raccoon eyes which may develop soon after the injury. But why do they develop? Anatomy of the skull base. The base of the skull contains numerous blood vessels and sinuses. When a fracture occurs in this area, it can be damaged, leading to bleeding. Gravity and tissue connectivity. The skin around the eyes is very thin and loosely connected, which allows blood and other fluids to easily spread and accumulate in this area. Due to gravity, blood at the base of the skull can seep downwards towards the soft tissue around the eyes. Communication of spaces. The facial bones and skull base are connected through various small anatomical passages and spaces. When a fracture occurs, these passages can allow blood to injury to the area around the eyes. No blood-brain barrier. The area around the eyes lacks a blood-brain barrier, which normally restricts the movement of substances between the bloodstream and neural tissue. Therefore, when bleeding occurs because of a skull fracture, it can more easily into the periorbital tissues. Here we see a picture of late raccoon eyes. Once you see raccoon eyes, immediately look at the tympanic membrane. Behind it, it is one of the best signs of a base of skull fracture. It can be difficult, especially if there is fluid in the ear or if the TM is ruptured, but if you do see it, you can be sure of your diagnosis. Here we can see an example of what it would look like. The last sign may take a few hours to develop, and that is Battle's sign, which we can see here. It is bruising behind the ear. It develops for the following reasons. Location of the fracture. Battle's sign typically occurs with fractures of the base of the skull, particularly those involving the temporal bone and the mastoid process, which is located behind the ear. Bleeding from fracture site. When the skull base is fractured, blood vessels in the area can be damaged. This leads to bleeding beneath. Gravity and tissue connectivity. Like raccoon eyes, gravity plays a role in Battle's sign. Blood from the fracture site can seep downwards and collect in the soft tissues around the mastoid process behind the ear. This area, like the has loosely connected tissues that allow blood to spread easily. It is important to note that these signs can take up to 4 hours to develop. In our patient, his low GCS would prompt an urgent CT scan, but I have had many cases where patients present following trauma, but who have had these signs. Any patient where a base of skull fracture is suspected, regardless of GCS, requires a CT scan, but please leave it to a trained radiologist to make the diagnosis, because the fracture lines can be extremely as seen on our example here. If it weren't for the little arrow pointing out the fracture, it would be very easy to miss. The most important thing in the emergency department is not to stick anything into the patient's nose, such as attempting nasal intubation or a nasogastric tube. If the cribriform plate is damaged, you can easily push these into the cranial vault. Thank you for joining us today at ER Mentorship Hub. We hope this session on base of skull fractures has been enlightening. Remember, quick assessment and appropriate management make a huge difference in outcomes for these patients. If you found this video helpful, please like, share, and subscribe for more insightful content. Hit the bell icon for notifications on our latest videos. Every day is a new learning opportunity in emergency medicine, and we're here